Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk a little bit about finding the right dose for patients for ketamine treatment. So this is a question I get a lot because there is an idea, I think, right now that the more the merrier, the more the better. I'll have patients come in and say, just give me the whole bottle. I can take it. And I don't really think that that is the best way for evaluating the right dose for a patient. So when we look at dosages for medications in medicine, we're looking at trying to minimize side effects and maximize potency for any particular patient. When they did studies on ketamine, the majority of the studies, 95% of the studies, were done with a dose of 0.5 milligram per kilogram over 40 minutes. And if you're trying to think of a translation between pounds and kilos, it's about 2.2 pounds per kilo. So take whatever your weight is in American pounds and divide that by 2.2, and that's the number of kilos, and then multiply that by 0.5 or divide it in half, and that would be the number of milligrams per kilogram in the sort of classical original studies done on ketamine treatment. And usually that was administered over about 40 minutes. Now, when someone is choosing a dose for a study, you're not going to be sliding up and down the dose scale. You're not going to be optimizing each dose for each patient. You really can't have that much variability in your study, or the results aren't going to mean very much. They won't be statistically significant because you have lots of other variables going on. So when we do studies on patients, the dose has to remain the same. So that may be the best dose for every person, but more than likely that dose is going to be a little too low for some people and a little too high for other people. And it's going to be kind of just okay for most people. When they chose a dose for ketamine, they sort of chose a dose that most people would feel, and it wouldn't be too strong for almost anyone. So it was kind of a little bit on what we think may be the low side of things. So most people will be comfortable, and it won't be too much for all except for the smallest percentage of people. So the 0.5 milligram per kilo dose, most people tolerate very well. There is not very much nausea at that dose. There's not very much kind of hanging on by your fingernails. This is very frightening at that dose. It's just a very comfortable, well-rounded dose. Having said that, what we're looking for when we optimize the dose for each patient is sort of this Goldilocks zone of this is a very comfortable, very floaty, very vivid experience, but yet we're minimizing the nausea. We're not having it be a very negative experience. And so it really is about each individual patient. And there are lots of individual factors that make the dose need to be adjusted for each patient. So when they do 0.5 milligram per kilo, that's on ideal body weight. So there are lots of people in this country who are outside of the ideal body weight range, whether it's too low or whether it's too high. Sometimes doses need to be adjusted for that reason. Sometimes a patient is on different medications that can increase tolerance for all medications. Sometimes a patient is on different medications that can decrease tolerance to medications. Sometimes patients just genetically have a lot more susceptibility to the floatiness or the inebriation type effects of ketamine. And so they need a little bit slower infusion rate, or they need a little bit lower dose. Sometimes patients at the extremes of age can need dose adjustments. So for all of those reasons, the typical 0.5 milligram per kilo over 40 minutes dose that is used most frequently in studies may need to be adjusted up or down And sometimes we'll adjust the time element as well to find the perfect fit for each individual patient to get them to a spot where they're feeling very vivid, very floaty, very much having the experience of the medication, but not having the side effects of having too much of the medication as well. And so the downsides of having too much of the medication, the higher the dose, the more chance we have of nausea, the more chance we have of a quote, bad trip where patients have an uncomfortable or emotionally very challenging experience. And also the higher the dose, the more chance we have of having ketamine act like an anesthetic, where patients just sort of have a blackout moment for the experience and say, gosh, I feel like it just started, or I missed the whole thing. I don't remember anything. And that's not a great experience either. That's losing the whole experience. So we really want to work with each individual patient to find the best dose for them. And that takes a little bit of fine tuning, a little bit of tweaking, to make sure that they're having the most benefit from the experience with the least side effects.